Okay, we're almost there. Uh-oh, somebody is come say hi. It's been giving me an error. Okay, I'm getting your water. Hold on. He's so mad. He's laying on the floor now. Oh my goodness, it's not letting me go on Facebook. Third time's the charm. Oh, we might be live here only. Okay, now it's working. That was 4 times. Oh, sharing our page. Awesome. Welcome, welcome. It is Thursday night. We are so excited to be here with Lisa today, Lisa Paladino. I am going to let Angela introduce Lisa today, Lisa Paladino. Introduce the topic and introduce our guest. So,
awesome. Thank you, Renata. Lisa is an international board certified lactation consultant, an IBCLC, and certified nurse midwife, CNM, in private practice in Staten Island, New York. While her lactation practice is concentrated on the issues of tongue tie, she also treats those struggling with hormonal, thyroid, milk supply, or fertility concerns using functional medicine protocol. Lisa is an RN, registered nurse, since 1987, a CNM since 2008, and an IBCLC since 2011. She worked for 28 years at Staten Island University Hospital before establishing her private practice in 2015. At the hospital, she co-founded and coordinated the Breastfeeding Initiative and worked in collaboration with the New York City Department of Health on efforts towards achieving the baby-friendly designation. Lisa's unique qualifications as both a nurse practitioner and lactation consultant give her the ability to diagnose and prescribe treatment protocols for breastfeeding management as an independent provider without need for physician consultation. As a member of the International Consortium of Oral Ankylofrenula Professionals, ICAP. I'm not even wearing my Invisalign and I'm tongue-tied. She is experienced with assessment, diagnosing, and treatment protocols for infants with tethered oral tissues, tongue and lip ties, and has a network of professionals for collaboration and referral. Lisa the weekly show, the Tongue Tie Experts podcast, and provides education to parents and professionals through the Tongue Tie Experts brand on Facebook and Instagram. She loves to lecture and educate the world on the importance of breastfeeding for the health of infants and the developing airway. Lisa, we're so thrilled that you're here to join us tonight on Airway Circle, and we welcome you to our platform. So glad to have you here. Thanks for being here.
Thank you, Angela. And I'm going to share my screen now. Hopefully that will work.
Perfect.
I always get nervous at this point. Like, will it all work, right?
All right. I see your screen. We see it. Yep. Up and running.
And you see just the slide now, right?
I see the one main slide and I see your side slides.
You do? Okay, that's weird because I don't even see my side slides. Hold on.
Yeah, is there a presentation mode maybe?
Yeah, no, I thought I was in it.
Oh.
That's not what I wanted to do. It's weird because when I have presentation mode, it says resume share. Stop share. Okay, sorry. Let me try this again.
Okay, yep. And then so all I see right now is just you. So that's maybe
Right.
a second time's a charm.
it was sharing for me. Is that what you guys are talking about?
Yeah, but were you seeing?
Yeah, it was on. There we go, Lisa. It's perfect.
Back. Okay, great.
Yes.
Thank you.
You got it. Perfect.
Before I begin my presentation, I just want to express my gratitude to Renata and the Airway Circle team, Angela as well, for inviting me and for supporting me to present tonight. I'm new to this group, and on reviewing past guests, I'm in awe of their clinical and educational contributions. I'm honored to be included among some of the giants in the field of airway health, so thank you so much. Tonight we're going to start at the beginning, connecting breastfeeding with airway health, in my perspective. So a little bit about me. And, as you read my introduction, I feel older and older as time goes on, because I can't believe all that I have accomplished, because I feel like I'm only 25. So, it's crazy. But a little bit about me, because I always like to understand who the person is that I'm learning from. So I like to include that I'm married for a very long time to my college sweetheart. I'm the mother of 3 kids. I'm a grandmother since January. That's my grandson in the center of the slide. That's Daniel in his Mets shirt. We're very big Met fans over here. Even though I'm a mom to 3, I've raised 7 kids altogether. And I love learning. I love hiking. I love hanging out with my lazy and very spoiled dogs and watching the New York Mets. And tethered oral tissues treatment has been my focus for the last 10 years. It just is somewhere where I've just been drawn to and felt the responsibility, because there was no one that I knew in my area who understood that. So I undertook a learning journey about tethered oral tissues post schools. And here I am. I have the Tongue Tie Experts podcast. I have the courses for parents and professionals, and the book, It Shouldn't Hurt to Nurse Your Baby. And I run multiple large Facebook groups to support breastfeeding and tongue tie. And that's a little bit about me. Okay, so my objectives for tonight is for you to learn the role of a lactation consultant, to understand the importance of breastfeeding to the structure of the developing human, to learn the risks of a bottle feeding culture. Notice I say bottle feeding culture, not the risks of bottle feeding, because that's beyond what I want to say, and to connect interdisciplinary dots starting at the very beginning. So most of us don't even know what a lactation consultant is. I mean, I saw or heard you tripping over the IBCLC. It's a lot of initials. There's a lot of words there. And the profession is new. It's a new field. It was founded in 1985. So it's not been around. It's growing. It's important. But the most important thing to know about IBCLC is it is the highest designation for lactation support. There are a lot of different levels of lactation professionals and lactation help. CLC, CBC, I could go on and on. It's like the alphabet soup. They all have their place, but IBCLC is the gold standard, requires many years of specific education, hands-on training, passing an exam, and recertifying every 5 years. And I just had to retake my exam, because every 10 years we have to retake the exam. It's a very, very rigorous. Of all the initials after my name, IBCLC is the hardest to maintain. Okay, so I always like to start with this before I start talking about breastfeeding, because I never want anyone to be triggered or to feel badly about their own experience. I didn't get any of this right with my own children. That's not why I, teach what I do. This is a judgment-free zone. You know better, you do better. You do the best you can until you know better. Then when you know better, you do better. So the thing about this topic is, even though I don't want anybody to feel badly, and I don't feel guilty about what I've done with my own kids, I wish I could go back and change it. That being said, we all need to do better as a society, and I'm gonna make my case for that tonight. So humans are mammals, right? And the closer we stay to our biology, the healthier we will be. Human babies are meant to be fed human milk at the breast. And, we realize that nobody's telling the dog that they're spoiling the puppies, or the cat that she's spending too much time with her kittens. Biologic attachment is the norm for mammals, and breastfeeding until the natural age of weaning is between 3 to 5 years, and that's the ideal, right? So we have to think about that when we're putting things in perspective. And again, the less we interfere with our biology, the healthier we will be, and I claim that quote. So let's give this some thought. Let's take a moment and think about that our health since the Industrial Revolution has not increased. Our mortality rates maybe have increased, but not our overall health. We have strayed very far from nature. And I'm going to ask you to keep this in the back of your mind as we proceed today. Human babies are meant to be fed at the human breast. And what does that mean when it doesn't work? Okay. So, some health parameters that concern me. 3 to 12% of children snore, and obstructive sleep apnea, depending on what study you look at, affects 1 to 10% of children. The incidence of infant plagiocephaly is as high as 46% in some studies. And I know we have multidisciplinary providers on the call tonight. Plagiocephaly is the misshaping of the head in such a way that it interferes with normal development. And that's a large number. And I have taken a lot of statistics from my local information. So I'm in Staten Island, New York, a part of New York City. So I'm looking at the number of New York City school-age children approved for special education services in 2020 was almost 500,000. And 29% of that was attributed to a speech or language impairment. So how did we get here? I'm going to ask a lot more questions than I answer tonight, unfortunately. But I always ask why. As you mentioned in the bio, I'm trained in the functional medicine model, and I'm always looking for the root cause. I'm always asking why. I first presented this talk to a pediatric therapy organization with 3 locations on Staten Island, and they're a wonderful practice, and they do beautiful things with children. But I asked myself, why do so many kids need services? What is happening that we have to have so many kids, have so many specialized services in order to have, to become functioning humans? We all do wonderful work, but from a population perspective, it's not a healthy trend that so many of our kids need extra help to breathe, to speak, or to learn. So let's talk about the professional recommendations for breastfeeding. The professional organizations agree on paper. Here you see the recommendations of the American College of OBGYNs, the Academy of Breastfeeding Medicine, the American Academy of Pediatrics, and the World Health Organization. The top organizations that are in charge of this issue, and the consensus is that human milk is the preferred feeding for all infants, and it's recommended that breastfeeding continue for at least the first 6 to 12 months and thereafter for as long as mutually desired. So how are we doing? What's going on in our world? So back to my local stats. On Staten Island, in 2017, only 24.7% of infants left the hospital without getting some formula feeding by bottle, meaning that already in the first 2 to 3, maybe 4 days of life, they were not exclusively breastfed. And I know from behind the scenes, because I used to work in the hospitals, that most people come in. It was up to 80 to 90% of people came in saying they wanted to breastfeed. So this isn't about making people breastfeed who don't want to breastfeed. This is people who said they wanted to breastfeed are failing. In the US in 2018, only 25.8% of infants were exclusively breastfed through 6 months, which is the minimum recommended by all those organizations that we went over. And 34% of infants were born by cesarean section in New York City in 2017, and that's That's the latest stat that's available. Now, what do the C-section numbers have to do with breastfeeding? Again, I ask a lot of questions that I may not have the direct answer to, but I feel like it's a concern for many reasons. And, are babies' heads getting bigger or shaped differently before they're even born? Are maternal pelvis shapes changing? Or is this just a result of turning childbirth into an assembly line business? I have my own opinions as a midwife, but that's a whole other presentation. So let's think about research studies versus clinical experience. In my experience as a professional who's in the unique perspective to care for mothers and babies, our world would be healthier if everyone was supported to breastfeed. So here I will connect some research with my own clinical experience. In my clinical practice, there are some observations that I make. And these observations are what I surmise have led to some of the conditions that we are seeing today. As far as breastfeeding not working and the shape of the mouth and the developing oral structure, we have overuse of buckets, which is a fancy or a slang term that we use in the field, containers to hold babies. Lots of babies are being put in things instead of being held all the time. Overuse of swaddling, pacifiers, and obsession with sleep training, and infants on medication to treat colic and reflux instead of looking at and finding out what's going on there. We just medicate them. Of course, tethered oral tissues such as tongue and lip tie, torticollis, which is head preference to one side or the other, or not being able to turn from one to both sides equally, plagiocephaly, which is a misshapen head, and the inability to be comfortable in tummy time. I saw Michelle Emanuel on the call tonight, and she's the tummy time guru, and I learned from Michelle that if a baby is not comfortable in tummy time, it's a sign that something is up. So why are we failing? Why are 60% of parents not reaching their breastfeeding goals? Could be issues with latching, which could be pain, could be inability of the baby to open his mouth to latch, the inability to move the tongue to extract milk, swallowing difficulties, and the majority, but not all of these issues are related to tongue and lip tie. Concerns about not making enough milk is one of the chief reasons why people stop breastfeeding. I had a family here today who everything looked like it was going well, but she started giving bottles just because she was worried. Nobody was reinforcing her to trust her own body to make milk. And honestly, only 1% to 2% of women will not make enough milk if they have the proper support and guidance. Concern about taking medications while breastfeeding is a big reason why people stop. Most medications are not passed through breast milk, but most physicians and pharmacists don't understand the mechanisms of medications passing through breast milk, and they're very nervous to allow or to recommend that a mom who's breastfeeding continue to breastfeed when she's on medications. Unsupported work policies and lack of parental leave. Again, this is not on the individual parent. This is on our culture. Most states have laws regarding pumping at work, but without paid family leave in every state and other protections, this is a challenge. Cultural norms and lack of family support is very interesting. We actually did a study when I worked at the hospital, and if your mother had breastfed and reported breastfeeding and meeting her own goals, you had an 80% chance of breastfeeding yourself. And if your mother did not breastfeed, you had a 20% chance of breastfeeding. So it really, really matters what women, what families see in the culture and in their own family. And then, of course, unsupportive hospital practices and policies. And as we mentioned before, I worked on this for 8 years at the hospital on the Baby Friendly Initiative, which is really the minimum standard to get things supportive for families. And it's very difficult to achieve the baby friendly policies in the climate of most institutions in the United States. So, is the monopoly of education about infant feeding the real reason that we are failing? I think it might be part of it. And this is part of what I learned when I was fighting the powers that be when I worked at the hospital. Formula companies are strong. And by the 1940s and 1950s, physicians and consumers regarded the use of formula as a well-known, popular, and safe substitute for breast milk. And that's when breastfeeding experienced a steady and rapid decline. Many do not know that financial support from formula companies helps educate our doctors and nurses, and even builds hospital, wings. Newborn nurseries, pediatric clinics are built by funding from the formula companies, which is part of the reason that baby-friendly hospitals don't succeed, because in order to be a baby-friendly hospital, you are not allowed to accept financial support from the formula companies. And you're also not allowed to accept or give out the free gift formula to new families as a baby-friendly institution. But when you do allow that to happen, it's essentially free advertising. And since I made these slides, we've had this formula shortage in our country. And that's tied to, I could do a whole presentation on that itself, but that's tied to our dependence on certain brands that are given preference by our government. So it's very tricky. And statistics and studies show that if a family is sent home with free formula, they are twice as likely to supplement unnecessarily. So the other thing is, I think that it is time to change the paradigm. We have to be very careful about this. But it's time to start talking about the benefits of breastfeeding or the risks of bottle feeding. And as you'll see on the next few slides, the more that we learn, the more research that comes out about the risks of bottle feeding, the idea behind this becomes stronger. So this is a part of a brochure that's taken from the California Department of Health WIC department. And it's talking all about the risks of bottle feeding, the risks of formula feeding, right? And they didn't even talk about bottles. This was just formula itself, right? So lots of things that are higher. Instead of saying, babies get sick less when they are breastfed, they're starting to say that babies get sick more when they're given formula, which is an important shift of paradigm. And then this right here highlighted it's a hard situation, and I hope I'm not, being triggering to anyone, but it's important to talk about. There is a greater chance of dying of SIDS for babies who are formula fed. And that's a sad fact, but it's, it's something that we can't ignore anymore. It's got to be talked about. So sudden infant death syndrome is the sudden and unexplained death of a baby younger than 1 year old. This is made if the baby's death is unexplained. And breastfeeding duration of at least 2 months is associated with half the risk of SIDS. And formula feeding doubles the risk of SIDS. So many questions come up for me here. I don't have any answers, but it's just something that needs to be talked about, and we need to think about it and realize that our choice of how we feed our babies is more than just a choice for ourselves, right? Then when we think about sleep apnea and snoring, want to ask the questions, is SIDS the ultimate result of sleep disordered breathing and sleep apnea? We know for adults, sleep apnea doesn't always lead to death during sleep, but many have sequelae as a result of inadequate oxygenation. Are infants who are formula fed at risk for sleep disordered breathing and its consequences from birth? And is that why there's a risk for SIDS? We do know that part of the reason that it's believed that this happens, and there are studies showing that babies who get formula sleep deeper and don't have the impetus to awake and breathe as often as babies who aren't given formula. And don't you all just want to reach out and close this little baby's mouth? He's so cute, but I just want to close his little mouth. Okay. So let's talk about bottle feeding and oral facial development. And this is from a study, and I have all the resources at the end for anybody who's interested. In this particular study, children who are age four who were exclusively breastfed for 6 months when they were younger were divided into two groups. Group 1 used only a cup to drink, and Group 2 used a bottle. Lip closure was observed in 82% of the children in Group 1 and 65% of the children in Group 2. Tongue resting in the maxillary arch was found in 73% of the children in Group 1 and 47% of those in Group 2. Nasal breathing was observed in 69% of Group 1 and 37% of Group 2. And the maxilla was shown to be normal in 90% of Group 1 and 78% of Group 2. Now, this was kids observed at age 4 already. So the conclusion of this study was use of a bottle, even among breastfed children, interferes negatively with oral facial development. Now, am I saying that nobody should ever give a bottle? No. But we can't ignore this information and the fact that we have to prioritize what we know. Put it into practice. Okay. Now, a study about breastfeeding, snoring, and sleep apnea. And this study showed breastfeeding for more than 1 month is associated with a reduced risk for parent-reported habitual snoring, witnessed apneas at 8 years of age. And that's just 1 month of breastfeeding. And the longer duration of breastfeeding in the first year of life is associated with a greater reduction in the risk of parent-reported habitual snoring and witnessed apneas reported at 8 years old. The conclusion of this study was the finding is consistent with a beneficial effect of the breast in the mouth on oral pharyngeal development, with consequent protection against upper airway dysfunction causing sleep disordered breathing. And then we have a study about bottle feeding and malocclusion. A longitudinal study of 80 mother-child pairs monitored from early pregnancy to 30 months of age with variables of finger sucking, pacifier use, bottle feeding, breastfeeding, and nocturnal mouth breathing. At month 30, the children were examined for overjet, overbite, and posterior crossbite. Children with a finger sucking habit and those with low rates of breastfeeding were more susceptible to overjet and open bite. Children with a pacifier habit were more susceptible to overjet, open bite, and overbite, and posterior crossbite was associated with bottle-fed children and nocturnal mouth breathers. So, Back to the Future, we all think that this is brand new stuff that we're talking about, right? I'm going to talk a little bit about Dr. Brian Palmer. Does anybody know who Dr. Palmer was? Dr. Palmer was a pioneer. He passed away in 2012. He was a dentist and a researcher and somewhat of a pioneer. He was popular in this narrow field, lecturing about the importance of breastfeeding for the proper development of the oral cavity, airway, and facial form. He talked about infant caries and why tight frenulums needed to be addressed He talked about the signs and symptoms, causes and prevention, and treatment of snoring and sleep apnea, and the basics of dentistry not taught in dental school. So 1996, this is what Dr. Palmer was talking about. He said that anything placed in a child's mouth other than the mother's breast can impact occlusion. And while the soft breast adapts to the shape of the infant's mouth, anything firm requires the mouth to do the adapting, and the unnatural forces impact the position of the teeth and the shape of the palate. In addition, during breastfeeding, the tongue moves in a peristaltic motion underneath the breast, and this motion is critical for the proper development and alignment of the teeth and the shape of the hard palate. Breastfeeding helps develop a correct swallow pattern as well as proper development of muscles around the face and jaw. The muscle forces always win out over bone. Teeth will be moved, and we all know that now. And it is rare to find malocclusions in prehistoric skulls because breastfeeding was the only form of infant nurturing. We know that tight frenums can interfere with breastfeeding and can cause significant health and dental problems. And newborns should be evaluated for tight frenulums at birth and treated accordingly. Now, hello everyone, this is 1996. So for those who are saying that tongue tie is a recent fad, I'd say I wish we could talk to Dr. Palmer today. He also said wonderful things about lactation specialists and that how important we are to the team, and that breastfeeding is the key to the best and cheapest form of healthcare, and the ramifications of not breastfeeding are significant, and there is no system that will ever replace the act of feeding human milk directly from the breast, and that bottle feeding is a deviation from the biologic norm. Then in 2011, Dr. Palmer had an interview with Dr. Stephen Park. I'm not sure if everyone on the call is familiar with Dr. Stephen Park. He's an ENT, another pioneer in our field. He's got a great podcast too, and he's a great educator. Dr. Park stated these goals when Dr. Park interviewed Dr. Palmer in 2011. Dr. Palmer said these were his goals, and I included these because they are remarkably close to the goals of most of our educational endeavors today. We want to make connections across professional disciplines, and that's exactly what Dr. Palmer was preaching in his Too Brief Life on Earth, that it's important to educate the sleep apnea community about the importance of breastfeeding, and to educate the breastfeeding support community about the importance of sleep apnea. We need to talk to each other. And to educate dental hygienists on how to screen their patients for sleep apnea. Also, oral myologists, speech therapists, sleep techs, or anyone else who works or looks in patients' mouths. So why haven't enough people gotten the message? I'm not sure if I have the answer, but I have some ideas. We are taught in silos usually, right? We don't learn what each other learns. We don't usually learn together. Why don't any of you in your, or maybe you've touched on the benefits of breastfeeding, but I'm sure you haven't heard it to the degree that I'm talking about. And why didn't I learn what OTs, what PTs, what SLPs, what RDHs, why didn't I learn what these people do, these professions do, when I was in school? Why don't pediatricians learn about how medication is passed in breast milk, right? There's just so many things that we're not talking the same languages because we're learning separately. Even as, if I go to a lactation consultants conference, it's all lactation consultants. If I go to an IBCLC conference, same. If I go to a midwives conference, same. If I go to an RN conference, it's all RNs. And for once in this community and in others, we're starting to come together, different professions. And we are not taught to ask why. And that's vital. We have to start asking why about everything. So I'm starting to see the light. We're seeing interdisciplinary professional associations. We are seeing more research. We're seeing social media helping with awareness. We have lots of smart people having children. How many of us have come to this field because of the, observing our own children, having experiences with our own children? So many of my podcast interviews are people who are professionals who started out as parents who had a problem with breastfeeding or a problem with any one of these parameters along the way, and decided to dig deeper and learn more. Interdisciplinary education programs such as this one, my own course, professional conferences. More providers are getting comfortable to think outside of the box of what was taught in school. The work of the professionals on this panel, in this group, and others like us all over the world, projects such as Airway Circle, the Airway Revolution Foundation, which is another project that I'm involved in, and others. We are all spreading the word. So thank you. And if anybody wants my links, they are there for all my stuff. I'm basically tongue-tie experts anywhere you want to Google it.
Well, Lisa, this was fantastic. Thank you so much. You really touched on so many points here. We do have some questions for you. I'm going to go ahead and start by asking in the chat box here on Zoom. So for those of you listening in on Facebook, feel free to type into the comment section and we'll be able to get to your questions there. But we have one question here in the Zoom chat. Do you think the increased risk of SIDS may be more related to the fact that formula-fed babies are typically struggling with myofunctional issues, as in those who could not successfully breastfeed and were missed for the tethered oral tissues diagnosis?
Yeah, I do think, yes, Kimmy, that's a great question. And I think this is a multifaceted issue. Now, I am by no means an expert on SIDS and babies, but when I am an expert on the way breastfeeding works, and I am an expert on babies being missed. And so many kids compensate and don't get diagnosed as infants, right? And, the human beings are amazing. So yes, could they possibly be having problems? They couldn't take a bottle, so they have airway issues, and it's the airway issue. But formula fills the baby and makes them sleep longer and deeper, right? So breast milk is very easily digested, and babies are meant to wake up frequently to breathe and to feed. And when they get formula, they go into a deeper sleep. So that's it. It's multifaceted, but that's definitely a great question. And we do know, for some reason, if you're not familiar, look up Kevin Boyd's work, and there's others like him who have studied how our human skulls are changing. And there's definitely more now. We don't exactly know why, but there is more misshapen faces and skulls and mouths from birth. I mean, I see that because I see them in my office here every day. But yeah. And I see that Judy says we miss Dr. Park. I do too. I miss Dr. Park terribly. I've referred to him all the time, and he's retired.
Yeah, we do have Dr. Courtney now that we just met whenever we went to New York, and she trained.
Really?
She was a fellow of Dr. Stanley Liu, so she knows
great.
all. Yes, she's
Perfect.
a great one, and she's a Mount Sinai. Can I say it?
Yeah,
Definitely.
Yeah, Dr. Park. Everyone loved Dr. Park.
I know. We have a couple questions on Facebook, but I think you just answered them. They're pretty similar. And then Judith just said, who do you recommend? Dr. Courtney? What is her last name, Ange? Do you remember?
Her last name is Chow, Chou. She's at Mount Sinai. She, I just want to mention for those of you who are thinking of her, she does see, she actually emailed me today, so that's why I'm responding. She primarily sees adults over 18 or individuals over 18, although she will see some patients for sleep disorder concerns. She did refer to pediatric ENTs in her practice. Dr. I'll give you the name, sorry, one second, for those who are in New York and who are interested, Dr. Londino, Londino, and Dr. Alyssa Hackett. I could put that in the chat.
And they're also at Mount Sinai?
Yes. They're she's part of the she is considered part of the division of sleep surgery there. It's part of the Department of ORL, head and neck surgery, at Mount Sinai's Icahn School of Medicine in the city.
Thank you.
Thank you so much. For you guys that don't know, that was Anne that's talking. She's our
Thanks. Sorry, we're getting to like all the people who are in New York. Sorry to leave anyone out here.
Yes, can you please put the names in the chat? We actually have the names in the Zoom chat, Facebook, but we'll share them on Airway Circle Professionals page. So make sure you're part of that so you can get the names of everybody. We'll also post them over there. Do we have any extra questions, Ange? I was trying to pull the agenda.
I see a question about the references, and will my slides be up because they're on the last slide, all my references with the studies.
Yeah, so if you're an Airway Circle member, it's going to be available tonight already in Kajabi, and you can watch it and rewatch it and get all the info from there. Let's see.
Do you have any questions on Facebook that you want to ask, Renata? Has anybody posted there? Because I do have some questions here too.
Go ahead.
Lisa, there was a little bit that you touched on, like in the hospital setting or at childbirth. How is it that you assess for tongue ties in newborns?
So I'm not currently at the hospital, so I'm not seeing babies at birth, and I'm not a fan, and this is a little bit controversial among IBCLCs and among people who correct frenums. I'm not a fan of immediate release because I know that the stress of birth can often make it look like the baby's struggling, and we want to make sure that the baby's struggles are caused by the tongue tie. So I'm not one to suggest release to prevent problems. I feel like this is a functional diagnosis. So if we can get if things are working well, and by working well, there's a whole checklist of things, and there's no pain, and the baby's transferring, and there's no clinking, and there's no reflux, and all the things that cause a baby to struggle with tongue tie. If everything is working well, I don't suggest release. And then the other part of that is release is a trauma for the baby, and baby's just been through birth. Mom's been through a lot of trauma. I had a baby today that's 7 days old, has a tongue tie. Of course, they were told it was a slight tongue tie, which always makes me laugh, because usually if a doctor picks up a tongue tie, it's not a slight tongue tie, but that's another story. And mom was giving formula and not pumping enough, so she doesn't have breast milk enough yet, right? So if we sent that baby for release today or tomorrow, the baby's still not going to breastfeed because mom doesn't have enough milk yet. So we're going to work on building up the mom's milk supply. So I'm not a proponent of examining every baby and doing something about it in the hospital. And again, there are a lot of people who think it's the right thing to do. I just don't think. I don't think we also don't have enough educated and trained providers who know what they're doing completely to release ties in the hospital. And as somebody posted that osteopathy can potentially remove the need for release, that could be true. And also there may be other things in play, like the frenum may be being pulled back because there's tension in other places. So we want to work all that out first, if possible. Now, if the baby's got such a tie that they can't even open their mouth, and feed, that's another story. Like, this is an individual case-by-case assessment. But I'm not saying, okay, let's just, let's take that baby as part of the new birth screen, see if there's a tongue tie. That being said, if a parent is having trouble breastfeeding, I think they should be made aware that it's a possibility and that they should see an IBCLC after discharge. That was a little long-winded. Sorry, I could talk.
I think it was perfect. Thank you, Lisa. Yeah, I was reading some questions, and there was a mention in there, and then after it came out of my mouth, I'm like, oh no, we didn't mention hospital, but yeah, thank you.
I'm not sure if this has been answered yet. What do you say to moms who come to you and say their baby was assessed by an IBCLC at the hospital? I think that's what we're just talking about, and told you she does not have any oral ties, when in fact the baby does. What do
that
you
happens
think
to me once a week?
Right? What do you think needs to be done for those scenarios to become more rare than norm?
Well, first of all, that IBCLC, I'll say maybe she doesn't know about how to assess for tongue tie yet, because I was once that IBCLC at the hospital who didn't know how to assess for tongue tie yet. So we're going to cut her some slack. Number two, she may not be allowed to mention tongue tie, because there are gag orders at a lot of hospitals because of all the, it's a fad, it's this, it's money making, it's all this nonsense around it. So it might not be her fault. And then the same with pediatricians. Like, to a point, I cut them slack, and then I start saying, but, wake up and smell the roses already. Like, this is a thing, and we have to get educated, and we're all responsible to have education beyond our basic education. So what I do suggest for parents when that happens is somehow let it get back to the organization. My baby had a tongue tie. I was told my baby didn't have a tongue tie. This is what it caused us. Next time I have a baby, I'm not coming to your hospital. And then people will start listening, because it's the consumer that talks, right? We can scream and yell out here all we want. It's the patient who matters to the hospital. Not that individual patient, but the reviews of lots of patients, because I know I used to be part of that review team at the hospital. When patients complain, they get nervous. When patients start saying things like, because of what happened, I'm not coming to your hospital, they start listening. And it might take a trend, but that's the way things are going to change.
True
Oh, I
words.
was on mute. Go ahead.
True words, Jessica said. Definitely. That's a great advice right there. I love putting it back into the organization. What are less common symptoms that a baby might have oral ties that often gets overlooked or that moms may be unaware of?
One of the I think couple of things. One is slipping on and off the breast. If you've never breastfed before and you have a baby that has a hard time staying latched, you may not know that that's not normal, right? So, or it's not good. So, she said, I'm hard to hear. I'll scream. No. So hopping on and off the breast is a big one. Long feedings. So if feeding, I don't like to time feedings. I always say, watch the baby, not the clock. But if a baby is feeding for an hour and coming off the breast and 5 minutes later wants to eat, that's not normal, right? Something is wrong there. It shouldn't take that long. You shouldn't be feeding all day long. Now, I'm all for attachment parenting. I'm not saying you shouldn't be holding and cuddling and suckling, letting your baby suckle all day if you want to do that. But a baby shouldn't need to eat every 2 hours for an hour. That's not normal. And if you didn't grow up around breastfeeding people and you've never breastfed yourself, you may not know that that's not normal. So that, and then reflux.
Reflux, a big one.
Spitting up a lot.
Yeah. How about colic? I'm not sure if you touched on colic. Everybody says my baby had colic. Is there such thing as true colic?
Colic is a symptom. That's how I feel.
Colic, so what are usually the issues that could cause the baby to have
air, or in the very beginning, and this is sometimes makes parents sad to hear, But a lot of the babies that are, I hear my baby has so much gas. Most of the time, the baby's hungry. The baby's not getting enough. And that's why they're crying, because that's the biggest reason for crying in a newborn is hunger, right? So I see a lot of babies who's, they come in and the parents are like, oh, he's crying all day long. And the baby hasn't gained any weight or is underweight or, and that's why the baby's crying, because they're hungry, so it's kind of sad, but that's that, or getting a lot of air with swallowing, which will cause gas, which will cause pain. Colic is literally pain, gas pain, really,
And there's so many babies. My goodness, if I knew what we know now, right?
Yeah.
And do you want to do the next one?
Yes. Can you talk a little bit about the role of herbal supplementation or nutrition for lactation?
Yes, I can. So yes, there's no magic bullet. That's how I feel about breast milk supply. You can drink every tea, you can eat every cookie, right? There's lactation brownies and cookies and drinks, and there's something going around about some color of Gatorade that helps you make more milk. If you're not removing milk, you're not going to make milk. That being said, there are some, Renata's clapping, I like that. There are some herbs and supplements that I do recommend. First of all, I recommend repleting the normal supplements that we should all have high levels of. So we want to make sure there's no anemia. And by anemia, for those who understand the difference between checking for hemoglobin and hematocrit and checking for ferritin. So we want to make sure there's no underlying anemia. The docs, OBGYNs and myself as a midwife, I was taught just check the H&H, and as long as it's fine, you're good to go. Not necessarily if you're going to feed another human being. You need ferritin stores. So iron, vitamin D, everyone I test is low in vitamin D. And you need vitamin D to make your hormones, and you need hormones to make milk. So vitamin D. So I like the basics, B vitamins if you're not eating a lot of red meat, if you're vegan, if you had gastric bypass surgery, you should be taking a B12 supplement every day, a general multivitamin. And there's an herb that if somebody's having problems, I like the herb shatavari for supporting milk supply, and because it's a nice adaptogen, that's a woman's strengthening adaptogen. And then I like the herb motherwort, which is also it's a nervine, which means it's a relaxant, but anti-anxiety, but it has no side effects. It doesn't make you feel sleepy. It's safe for nursing, and it also helps with letdown. So that's my general. Oh, and then the normal, omegas, fish oil, probiotic if there was a C-section or anybody got antibiotics during the labor or birth. I'm trying to think what else. And magnesium. So magnesium.
Amazing. Yeah. There's a great question over here. When might a feeding assessment be warranted post-frenectomy?
I think a feeding assessment is always warranted post-frenectomy because you want to see what things are improved. I like to make a list of the symptoms for frenectomy. So why are we doing this? Make a list of those symptoms. Let the parents watch those symptoms. And as the lactation consultant, I watch those symptoms. I like to see babies 3 to 4 days after the procedure. And then a week, depending on the situation, depending on the experience of the parent and what else is going on, either a week or 2 weeks after that. And I find that gives the best outcomes. People don't slide away from you. There's sometimes things that can be adjusted to make things easier, and families aren't aware of that. So as the lactation consultant, I can see the subtle adjustments that need to be made in the latch or the routine of the family that can help things go smoother for them.
We just have a couple last questions, Lisa, before we wrap it up for the night, because it's just about hitting 9 o'clock right now. With COVID, that we had to go through the COVID times, a lot of offices switched over to telehealth visits. Are in-person visits just as effective as telehealth visits?
So there are many lactation consultants that became expert at telehealth. I have to admit, I was not one of them. I do not like it. I am very hands-on. It's so hard for me to try to explain to a parent how to lift up the tongue. I can't really see the motion of the mouth, but there are lactation consultants that do that beautifully. So if somebody is looking for a lactation consultant and they can only see them virtually, I would ask specifically, how much experience do you have? Are you comfortable? Is there anything you want me to do? Today I saw a great video that somebody made, a lactation consultant made, advising parents how to examine the baby and what videos and what pictures to have ready before the visit, which I thought was very clever. I never thought of that. I only limited my in-person practice for a couple of months. I kept it going. It fell off, of course. It wasn't, but if anybody really needed to be seen and they were local to me, we masked up and all precautions were taken, and we kept going because I like being in the room. There's something about being in the room with a family, you know.
Definitely. Before we go, would you talk a little bit more to everybody about your wonderful podcast?
Oh, sure. Because you're going to be my next star. So I have the Tongue Tie Experts podcast, and it is available on all major podcast apps. And the goal of the Tongue Tie Experts podcast is to get this information out the same way Airway Circle is to connect people and get information out. It's for parents who want to learn more or want to hear other parents' stories. So I ask parents stories, and I have parents on. And it's for professionals who want to learn about other people's professional experience and tell families what they offer. And I interviewed Renata, and she'll be on in a couple of weeks. I'll let everybody know when that's happening. And if anybody wants to be a guest on the podcast, I'm always looking for podcast guests, whether you want to tell your breastfeeding story, or you want to talk about what you do professionally in any level of breastfeeding, airway, sleep, any level at all, because I want everything included. And if you can, please, the best thing you can do to help the whole mission is to follow the podcast, because that's what helps get it up in the algorithm of podcasts and gets more people's ears on it. So following it, rating it. If you'd like it, give a review. I listen to someone that always says at the end of a podcast, if you like it, give us a review. If you don't worry about it. And I think that's so cute, you know.
One of my favorite podcasts, he says right in the beginning, I hope you're not listening to this, and please don't share it. And everybody's like, oh my gosh, I need to listen. I know, I love that reverse psychology.
Yeah, I love that. Yeah, don't follow me. Don't find a place to review it, you know.
Yeah, but I am
thank
going
you.
to follow
And
my
thank you
podcast.
guys. This was great. I loved being a part of this, and I'm so excited to be a part of Airway Circle.
Thank you. There it is, everybody. Let's follow and leave reviews. We asked for the same thing with the Airway Circle Radio. We just released an episode with Dr. Jasmine Elmore. She's wonderful. We love her. And I have a couple episodes already that we are editing to put it out there with Dr. Karen Davidson about nasal resistance and nasal breathing. And we have Lael is actually on a podcast also talking about her son's journey. A couple more things that are going on this month. One of them is our Circle Time meets on August 16th, I think is the date. And then ACBC, our famous book club, and can talk about that. You're muted.
After I take myself off and mute, of course. Yes. So our book that we're going to discuss is Wide Awake and Dreaming. It's a memoir about narcolepsy. And if you think that you don't have enough time to get the book, have it shipped to your house and read it, then it's on Audible. So take the time. It's such a good read. It's great. I think that narcolepsy, while we just don't really have a whole lot of patients and clients who we come across this quite often, it can be common, and it is something that I think that we all should be aware of. So she talks about her own journey as she puts herself through law school. And she talks about everything that occurs to her in depth with her narcolepsy, with cataplexy. And to learn about all of that is just fascinating. So take the time, join us on our book club on the 21st, and she's going to be there to talk to us.
Super exciting. And for those of you, we only have 2 options now for membership. So $35 a month is our regular membership. You get recordings of all these webinars. And then $100 a month, you get access to everything Airway Circle has to offer, besides the huge, like Launching or Mayo, any big course, but all the monthly courses that we do with the 2-4 hours, all of that is completely open for everybody to join. So it's time. Thank you, Lisa. And then Benny ends the show. Thank you, Lisa, so much for being here. We really appreciate you. You're wonderful. Guys, thanks for everybody that came. Same thing, make sure that you share, you follow Airway Circle. We're trying to spread this message out there so more professionals get this knowledge and they can help more patients. So thank you, everybody. Have a wonderful night. Bye.
Bye. Bye, Lisa. Thank you.